Prevention without tablets. Tips for headaches in times of COVID-19. Sometimes contradicting recommendations on NSAID, nonsteroidal anti-inflammatory drugs are among the most common pain relief medicines in the world. In times of the coronavirus pandemic have unsettled patients with chronic headaches. Two experts give tips on what migraine sufferers should be aware of. It's not easy for headache sufferers these days. First, they were warned about the use of ibuprofen and other NSAIDs on social media, then it was said that it was fake news. In the meantime, experts have agreed on at least one point. There is currently no scientific evidence for a connection between ibuprofen and the worsening of COVID-19 symptoms. Nevertheless, many patients with chronic headaches are still unsure whether and under what conditions they should use the known pain medication in the current situation. Therapy as usual. The advice is clear. If you know your headache, you can treat it with the same pain relievers as you normally would. It is important not to take these too often, as they can actually make the pain worse. It is recommended to take the medication a maximum of 9 days per month. There are also telephone consultation hours that many doctors' offices have set up and where the doctor can advise on acute pain. Not only in times of COVID-19, one measure is particularly important for migraine patients: non-drug headache prophylaxis. Cycling and jogging actually have a preventive effect. These sports are possible even with the current exit restrictions. Relaxation exercises are also almost as effective as a drug for migraine prophylaxis, whereby Jacobson's progressive muscle relaxation is currently the best studied measure. The underlying technology can also be learned via the internet or with the help of apps. And just as important, we now know that factors such as behavior, experience, social and physical environmental variables can trigger migraine attacks in people with a corresponding genetic predisposition. Those affected should therefore learn to control everything too quickly, too many and too sudden. Especially with children and adolescents, one should pay attention to regularity and rhythm in the daily routine. This included a regular sleep-wake cycle, a balanced diet, regular breaks and exercise.